What's going on? My name is Brian Carroll. I live in Jacksonville, Florida. Something came across my email. Many people reached out. Someone brought to my attention this article from Pennsylvania. This article that's titled "Pennsylvania Man Receives 23.87 Million Medical Malpractice Verdict After Being Left Temporarily Paralyzed." So my thoughts today. First of all, people want to know what I think about this. Is this common? Is this a common occurrence where people get paralyzed from back surgery? So I'm going to talk about that in a couple of minutes. But for all other things, go to powerxstrength.com. Check out the video that we have dropping tomorrow about when is back pain a problem? When should you start being concerned about back pain? We have articles and videos that go up twice a week. We have shorts every day here on YouTube. Please like, subscribe, turn on notifications, share this video. I am a McGill certified practitioner. I am not giving you medical advice. I'm not telling anyone out there not to get back surgery. I'm not saying that if you get back surgery, you're going to be paralyzed. What I'm trying to do is just give you some information and answer a question that a few people had for me. Brian, this guy got paralyzed. Is this common? Is this something that happens often when people get back surgery? So Pennsylvania man receives $23.87 million for medical malpractice, leaving him temporarily paralyzed. I'm not giving medical advice, just my opinion. So back surgery is not the end. If someone has back surgery, it doesn't mean that, oh my gosh, they had back surgery, they're never going to recover, they're never going to get their life back again, they're done. That's not what it means at all. Some people absolutely need back surgery. I don't know the specifics on this case. I don't know if it's a cervical issue or a lumbar or thoracic, but it could be a cervical because that's a common surgical practice for the cervical spine. That's a common surgery that you use for that. And we're going to talk about the specifics of what type of surgery it was, a laminoplasty, and what that actually is. And then we're going to talk about what actually happened that paralyzed this 57-year-old man. This surgery is most common on the bones in your neck or your cervical spine in a procedure called a laminoplasty. So in 2019, this guy, Spangler, underwent a laminoplasty at a hospital in York to receive some spinal stenosis relief. Lawyers claimed that he went in and everything was good, and then he woke up from the surgery and he was paralyzed. He couldn't move. So what is a laminoplasty? It's a surgery to relieve pressure on your nerves and spinal cord. It opens up your spinal canal, the tube that holds your spinal cord, through your lamina. The lamina is the bone at the back of the vertebra of your spine. Laminoplasty offers support and stabilization to your spine and prevents neurological complications like paralysis. That's ironic. He ended up getting paralyzed because of this. So I wonder how that happened. During the procedure, this is according to the court documents, neurosurgeon Dr. Joe, we'll call him Kramer, Dr. Joe Kramer mistakenly inserted a screw into Spangler's spinal cord, the law firm explained. Now, this is from the court. This is from the court transcripts. Despite alarms from the intraoperative monitoring system warning of the critical error, there's feedback there and safeguards in place if something's like really wrong, and apparently he ignored it. He continued the surgery and closed the incision. So lawyers say that Mr. Spangler awoke from the surgery and able to move, but for 10 hours passed. They let him sit paralyzed for 10 hours until they put him back into an MRI. Once they put him in the MRI, they realized that they had put a screw through his freaking spinal cord. So 12 hours later, he's back in emergency surgery. And after initially being paralyzed from the surgery, Spangler has undergone years of intensive physical therapy and has been able to regain some mobility, whatever that means. What is some mobility? Can he kind of move his limbs a little bit? He's not completely paralyzed. You know, that's kind of ambiguous, but I'm glad he's gotten better. Looking for the answer to your sleepless nights, sore muscles, and better overall well-being? If so, PowerX Strength CBD has you covered. All of our products are made of CBD isolate and have 0% THC, meaning there are no worries of failing a drug test or the worry of feeling high. With PowerX Strength CBD, we offer a wide range of products and payment options to ensure you have the option that best fits your needs. Don't just take it from me. All of our reviews and client testimonials on our site speak for themselves. You can even get 20% off your order by using code YT1306 at checkout. Go to powerxstrengthcbd.com to order now so you can get back to sleeping, recovering, lifting, feeling, and being better. He's undergone years of intensive physical therapy. Hopefully he's gotten with a good therapist that's helping him and trying to salvage the rest of his life. He's an older gentleman, but he's 57 years old. His life isn't over at 57, but with this paralysis, it might as well be in some ways. So regardless of the $23.4 million, it's not worth being paralyzed. At least in my opinion, wouldn't be a good enough payment for me. So he's undergone years of intensive physical therapy and has been able to regain some mobility. We talked about who knows what that means. However, his representation says that he continues to suffer from permanent and life-altering disabilities. He was a Harley-Davidson mechanic for 26 years. So what are some disadvantages of a laminoplasty? Side effects of laminoplasty may include bleeding, surgical site infection, pain or numbness, nerve damage, lack of bladder or bowel control, spinal cord injury, weakness, or paralysis. Long-term complications are rare but possible. They may include loss of spinal alignment, maybe a little bit of shifting, some retrolisthesis, some spondylolisthesis, some type of listhesis, kyphosis, recurrent stenosis, which what he was trying to get away from. He had some stenosis, and then lordosis, which it can treat people that have stenosis. Laminectomy and laminoplasties, these different types of procedures can be very helpful for someone whose legs are really numb. We're talking about lumbar now. I don't know specifically if he was at cervical or lumbar, but it's all in the same vein. Whether it was a cervical surgery, whether it was a lumbar surgery, I don't know too many people, client or not, friend or not, I don't know too many people that have only had one back surgery. I don't know. Everyone I know that's had one back surgery has had 2, 3, or 4 back surgeries. This applies to the neck too. Unfortunately, I talked to someone the other day at a funeral, and I said, "Hey, how's your neck doing?" He goes, "It's touch and go." He's had 2 failed neck surgeries, unfortunately. And what the doctors say? After the second failed microdiscectomy and laminectomy, it's going to be about a year before you get the fingers, the feeling back into your fingers. So he's thinking, well, why the heck did I even do the dang surgery to begin with? Because that's how I felt before. So my purpose of coming on and talking about this today is not to take a dump on surgery or on surgeons in general. Some people are so compressed with their bone, their posterior aspects of their vertebra, and their discs, their facets. They're so encroached with stenosis that their legs go numb and they have tingling down into their feet or burning down into their feet. So some people will need a spinal decompression. There's multiple different types of spinal decompressions, but you have to exhaust every non-medical or surgical effort first. And unfortunately, a lot of the time when people get with a physical therapist to try to alleviate spinal stenosis, like in this case, they go and have a cookie cutter, or they don't get an assessment done. And so they end up getting escalated and getting a surgery that they really could have avoided in some cases. Not in this case, I'm saying. I'm just kind of speculating on this case. But I see a lot of people that get unnecessary surgeries. I also see quite a few people that get surgeries that need it. It was a last resort and it was time to do it. So basically the court, after an 8-day trial, the court sided with the plaintiff and said that there was actually the expert witnesses ended up siding with the plaintiff as well and said that the safeguards were ignored. He should have never sewed him back up. And this guy's permanently damaged because instead of putting that screw in the pedicle or whatever part of the vertebra he was aiming for in this variation of a laminectomy, infusion, or whatever exactly they did here. Once again, they call it laminoplasty, but they may have done something to the disc and not just the lamina. They may have shaved down the facet a little bit. Regardless, The screw didn't belong in the spinal cord. And so does this happen a lot? I don't see too many people with super botched back surgeries, fortunately. I do see some. And unfortunately, sometimes the disc scar can, the nerve can grow into the scar and someone can get arachnoiditis. Their pain could be unrelenting and be even worse after they wake up. A lot of the times what happens with the back surgery is people get adjacent segment syndrome, where the level above or below starts to, since the segment is fused together, then motion needs to come from somewhere else. And so those levels above become affected. I don't see people with screws in the wrong place, typically. I don't see people with butchered surgeries like this case. So this is more of a rare case. So when I say avoid back surgery, is this possible for you to happen where you wake up and you're never the same again? Absolutely. But my purpose today is to tell you that some people need back surgery. But if you don't need back surgery and you haven't exhausted every measure short of surgery, then you should do that, because these things can happen. I don't know if you saw the case recently in West Florida where this surgeon was supposed to do he was supposed to remove someone's pancreas, and he, I guess, accidentally removed the guy's liver, and he died immediately. He just was on the wrong side of the body, the completely wrong organ that looked nothing like the liver, and he pulled it out of the dude and he died. So it's best not to go under the knife unless you absolutely have to. If you don't have unrelenting pain and symptoms that are there for months and months, some of the worst cases that we ever see are someone that gets an acute disc bulge and goes in for a fusion or a microdiscectomy, and the surgery doesn't turn out well. Then it can be a complete disaster. 3 or 4 fusions later, this person's still in pain. So when you're seeking out your surgeon, make sure you find one that is good and proficient at your specific type of injury and at what level. Are they just a neck surgeon? Are they a lumbar surgeon? Are they a hip surgeon or a knee surgeon that moonlight as a back surgeon? Ask these questions. The next thing you need to ask is, what are their success rates? Then you have to quantify what those success rates are. Are the success rates 10 years later, 70% of all patients have their symptoms relieved 10 years later? Or is it a little bit more murky than that? The patient survived the surgery. The patient reported that his symptoms were reduced. How much is reduced? We need to know specifics. You also need to talk to some people that have gone through surgery and rehab years later, not just a couple months later, not just weeks later, not just a year or so later, 2 years later, to see how they're doing after they've acclimated back to life and work and sport and all those things. Not that they just got their pain taken away when they woke up from surgery and then wrote a testimonial. Be careful before you go under the knife, whether it's a back surgery or not. I was considering back surgery at one time. I'm very grateful that I waited it out and sought the very best in the world to help me reduce my pain. Those of you that have pain on multiple levels and multiple tissues, I would avoid getting a back surgery as long as you can. You make your own call. I'm not telling you what to do. But in my case, I had multiple pain generators on multiple levels and multiple tissues affected. So yeah, I would have got a microdiscectomy in L4, L5. But what about my main pain generator at L5, S1 and my sacrum being split and my disc being flattened? So there's a lot of different things you have to consider before you get surgery. I'm available for consultations. I work with people that are post-surgery. Some people are trying to save from getting surgery, but then sometimes you have to walk someone through the surgical process. There's a couple surgeons here in Florida that we have are good, some up in Boston, some in Chicago. So this isn't a demonize surgeons, but this one is inexcusable. It's bad. People wanted to know my thoughts on it. There you go.
Hope you enjoyed today's video. Remember, like, subscribe, share, click the notifications because we drop videos twice a week. We also have a live stream every Friday where I answer your questions. Click below to see the latest video that we uploaded. Also, for our products, our CBD, our books that correspond with these videos, it's down in the description. For more information about all things Brian Carroll and Power Rack Strength, go to powerrackstrength.com. You can book a consult both virtually and in person with me. Enjoy your week, and thank you so much.